lecture objectives of today's lecture are that you will be able to understand the basic concepts of mycology and describe the structure and growth of fungi, and we'll briefly discuss and explain pathogenesis, and then we'll get into details of fungal toxins and allergies. So what basically are fungi? They are eukaryotic organisms having two medically important structures, and their cell wall is entirely different, which is consisting of chitin, which is a polysaccharide, and it is insensitive to antibiotics like penicillin because their structure is different. So these antibiotics will not have any effect on fungal surface, which are potent cell wall blockers of bacteria. So you have to keep this in mind that fungi are entirely different structures. They are eukaryotic and their cell wall is different. Then their cell membrane contains ergosterol, which is different from humans obviously, because in humans we have cholesterol, but in fungi there is ergosterol, and that is why it is used for the treatment in potent antifungal drugs like amphotericin B and azoles, fluconazole, ketoconazole. They act by blocking the ergosterol synthesis. So what are the types of fungi? Basically they are broadly classified into two forms, yeast form and mold form. Yeast, they are single cell and they reproduce by asexual budding, and mold on the other hand are long filament or hyphal structures that form a meshwork which is called mycelium, and these hyphae themselves can be of further two types like septate and non-septate hyphae. So you have to remember that yeast are single cellular, unicellular, and their mode of reproduction is different, which is asexual budding, while molds are different and they have a hyphal or mycelium form, and then further molds have two different types of hyphae, can be septate hyphae or non-septate hyphae. Then there is another type of fungi which are called dimorphic fungi. Because they are called dimorphic because they can grow at two different temperatures, at body temperature as well as at environmental temperature. We will not talk about dimorphic fungi in this lecture, but in later lectures it will be talked about, but today we are discussing only the basic things. Antiphagocytic, and less they can be antigenic in nature. Their structure is very multi-layered and comprises of 90% of chitin in it, and the other 10% is comprising of proteins and glycoproteins. So the function of the cell wall again is, it is providing the shape and rigidity and strength from the osmotic pressure. Then after the cell wall there is cell membrane, and in fungi the cell membrane is different. Obviously it is bilayered phospholipid comprising of ergosterol and zygosterol. There are two structures in it, and their function of the cellular membrane of the fungi is also protects the cytoplasm, and it also regulates the intake and excretion of solutes, and it can also facilitate or stop capsule formation and cell wall synthesis. You will further study the types of capsulated fungi are there, and then their cell membrane synthesis can be blocked by certain antifungal drugs for treatment of those fungal infections. So you have to know the function of the cell membrane and cell wall because they are important in terms of. Now we will talk about fungal spores. What are fungal spores and what are its types? They are significant in identification of these fungi. And why do fungi produce spores? Because it is the mode of reproduction, that's the sexual reproduction. They produce sexual spores, and if there is asexual reproduction, they produce asexual spores. Then there is another type which is parasexual reproduction, which is utilized in genetic exchange, but we will not talk about it in detail because at your level, at undergrad level, all you have to know is sexual and asexual spores particularly, and how they are able to produce spores. Those fungi are termed as fungi imperfecti. Sporangiosspore. Sporangiosspore is a little different from the black. Okay. Now we will talk about pathogenesis. Usually for the fungal infection, Cell-mediated immune response is the major line of action which forms the granuloma, and this granuloma is obviously different from the granuloma you study in the bacterial infections like TB or sarcoidosis. Sarcoidosis is not a bacterial infection, but in those type of granuloma are different. But in this granuloma, they are produced in major fungal diseases like histoplasmosis, blastomycosis, and it activates the cell-mediated immune system, and it will result ultimately delayed hypersensitivity reaction, so that even if you test the skin test, which is done usually for especially before trying out the antifungals, you do the skin test, and a positive skin test will indicate that the person is exposed to fungal antigen already or not. This is usually done in the immunocompromised population when we see the HIV patients or we are cancer patients who are terminally ill and they ultimately get fungal infections, and for their treatment when you have to choose the types of antifungal therapy, so we sometimes do the skin test to make sure there is no antigenicity to that. And then the fatty acids in the skin, they inhibit the dermatophytes growth, which is a protective mechanism provided to us by nature. But we will not talk about dermatophytes in this lecture, but in the successive lectures, Dr. Farhana will be talking about these superficial and systemic infections. And by nature, we have been given normal flora, and these normal flora of the skin and the mucous membrane, these are protective in the way that they suppress these fungi to grow. That is why we come across all the fungal infections in immunocompromised population, or if your skin barrier is lost for some reason, for like burns patients or some trauma patients, when your actual protection is lost, then these normal skin flora can gain access to the systemic sites and cause opportunistic infection. So you have to bear this in mind that we're dependent on the cell-mediated immune response for the pathogenesis of delayed hypersensitivity reaction occurs in fungal infection. And many fungal diseases, especially the respiratory ones, in which the host defenses are mucus, and when they are inhaled by nasopharynx, or if the fungi are trapped in the fungal spore formation in our lungs because of the alveolar macrophages, then what the body response is, it ends up producing IgG and IgM antibodies in response to these fungal spores which are entrapped in our respiratory system. And then obviously our cell-mediated immunity comes into action, and it responds by being protective, and it tries to reactivate our system so that the dissemination of the fungal disease is not happening. Biological stains are latex agglutination stains, which are not available all the time and they are expensive as well. And we'll talk about the fungal toxins and allergies. This is the second part of our lecture. Certain fungi cause disease by releasing their fungal toxins, and this disease is called mycotoxicosis. It's caused by the ingestion of the toxins. An classical example is the mushroom poisoning, which is caused by Amanita mushrooms. They produce toxins that are hepatotoxic, and they also produce ergotamine that produces vascular and neurological effects. Aflatoxins, which are produced by Aspergillus, can also cause hepatic carcinoma in humans. And there are certain people who are very allergic to the fungal spores, especially when there is construction going around, and then because of the construction of the buildings, these Aspergillus spores are very prone to get spread in the vicinity, and people get allergy because of that, and it causes bronchoconstriction. And it is also accompanied by eosinophilia, and there will be veal and fair skin reaction, which causes immediately hypersensitivity response. And these toxins can cause disease either by ingestion and then either by allergy because of the fungal spores. So we already talked about the mushroom poisoning, which is caused by Amanita mushrooms, and these fungi produce actually 5 types of toxins, but we'll discuss only 2 main types, which are very hepatotoxic, amanitin and phalloidin. And they are very potent hepatotoxins, and they can inhibit the cellular RNA polymerase, which prevents the messenger RNA synthesis and ends up disease. Another toxin which we will briefly discuss is ergotism, which is caused by a mold, Claviceps purpurae, and it's usually present in the alkaloids के अंदर होता है, and ergotamine, it causes vascular and neurological effects, but it's not as common as the one which is mushroom causes. So in summary, what we discussed today, that yeast and mold are different. One is unicellular, one is multicellular. And then fungal cell wall is different because of its chitin, and there is no peptidoglycan which is present in bacteria. We have chitin in the fungi. That is why the antifungal drugs will be different, and antibacterial are not effective on fungi. Chitin is a polysaccharide which is composed of long chains of N-acetylglucosamine, and the fungal cell wall contains other polysaccharides as well as like beta-glucan. And the medically importance of beta-glucan is that of the action of the antifungal drug caspofungin. It acts by blocking the beta-glucan synthesis. Then we have the fungal cell membrane, which is different from the human cell membrane because there is ergosterol, not cholesterol. And the selective action of the amphotericin B and azole drugs such as fluconazole and ketoconazole is based on the difference because of the membrane. So this summary again shows the major things which we discussed. You have to remember yeast being single cellular and the mode of sexual reproduction, asexual reproduction, and molds are going to grow like hyphae, and when they form a typical colony, it's called mycelium, and their mode of action, their mode of the multiplication is different. An important exception is Candida albicans, which is part of a normal flora because it's living on our skin harmoniously. But if the skin is damaged, it can cause opportunistic infection, which will be discussed later. And the classification of fungi is based on the sexual spores. And fungi that do not form the sexual spores are called the imperfect or fungi imperfecti. That's about it. Thank you very much. If you have any questions, you can post a comment. Thank you.